Hello, everyone, and welcome to today's webinar hosted by the International Society for the Prevention of Child Abuse and Neglect. Today's webinar focuses on the needs of parents who are struggling with 24/7 care of their children, along with increased stress, anxiety, illness, and financial instability, all of which puts their children at greater risk of abuse. In response, the organization Parenting for Lifelong Health has collaborated with the WHO, UNICEF, the Global Partnership to End Violence Against Children, USAID, and the CDC to develop a set of open source online COVID-19 parenting resources based on evidence from multiple studies on child abuse prevention programs that are available in more than 50 languages. Jamie Lackman, co-founder of the Parenting for Lifelong Health, will provide an overview of the initiative and the current response to COVID-19, including current resources to promote child protection and different strategies that are being used to disseminate them worldwide. Right now, I have everyone on mute to avoid background noise. We welcome you to enter your questions and comments in the questions box throughout the presentation. Jamie will answer questions at the end as time permits. Dr. Jamie Lackman is a research associate at the University of Oxford Department of Social Policy and Intervention and a research fellow in social and public health sciences at the University of Glasgow. In addition to co-founding Parenting for Lifelong Health, he is also the founder of Clowns Without Borders South Africa. He has more than 15 years of experience developing, testing, and scaling up family and parenting programs to reduce violence against children and improve child well-being in over 25 low and middle-income countries. Jamie, we thank you so much for being with us today and for your contributions to child protection. Now I will turn it over to you.
Thank you very much, Heather, and it's a pleasure to be able to participate in the ISPCAN webinar series. I just wanted to share my video for a moment so everyone can see who's talking to them before I go back to the presentation mode. So if everyone can you see, Heather, can you see the presentation?
Yes, it looks great.
Okay, great. Well, it's a real pleasure to be able to engage with ISPCAN on this important subject. I was quite crestfallen when I received the notice that the upcoming conferences have been postponed until next year. But I think, like how we have been able to come up with a creative way to continue to disseminate important information and research. I'd also like to just say before I get into the presentation that I'm really presenting this on behalf of a large team of people who have been working together on the Parenting for Lifelong Health initiative, as well as the COVID-19 parenting responses, including members of the University of Oxford and other universities, as well as the World Health Organization and UNICEF. So as a way of background, violence against children in the Global South recent reviews have noticed that over 1 billion children ages 2 to 17 have been exposed to violence each year, and that's about 50% of the world's population of children. And we know from research that most of this violence occurs in the home, especially for younger children around the onset of child behavior problems, but also it's an issue that is very important for later childhood and adolescence. And that the cycle of violence is really mediated by either poor or positive parent-child relationships. And not only does this have a human cost on the lives of children, but it also has a high cost on the economic output of countries. And a review that looked at the impact of violence against children in East Asia and the Pacific region found 1.36 to 2.5% of the GDP was cost of violence. Some of the consequences of violence against children are immediate, and some of them are long-term, and even some are intergenerational. Research has shown that violence against children is associated with greater risks of poor mental health issues, including depression and anxiety, as well as suicide and post-traumatic stress disorder, so higher risks of immediate injury, head injury, and other concerns. Also has increased risks of risky behaviors that can lead to both non-communicable and communicable diseases, including HIV, increased risks of sexual transmitted diseases, increased risk of obesity, heart disease, diabetes, cancer. Also, there's negative impacts on both maternal and child health, and poor nutrition and low cognitive stimulation of children. And we also know that the violence against children has an intergenerational impact, whereby children who are affected by violence are also more likely to either be perpetrators or victims of intimate partner violence, and also to use coercive and violent ways of raising their own children in succeeding generations. So preventing violence against children, and in particular parenting interventions, really addresses one of the core sustainable development goals, namely target 16.2, which is ending violence against children, abuse, trafficking, and other forms of violence. But also focusing on parenting and improving parent-child relationships has a possible impact on other sustainable development goals, including poverty, hunger, well-being, gender equality, reduced inequalities, improved economic output, and quality education. This has led to a global demand of scale-up of evidence-based parenting programs in low and middle-income countries. And one of the examples of this global policy framework is the INSPIRE package, which is 7 strategies to end violence against children that was launched by the World Health Organization and UNICEF, as well as the Global Partnership to End Violence Against Children. And one of these 7 strategies is to support parenting and provide parent and caregiver support through evidence-based interventions. So over the last 10 to 20 years, there has been an increasing number of rigorous evaluations of parenting interventions in low and middle income countries, starting to grow exponentially over the last few years, where we've seen over 90 studies, rigorous studies conducted on parenting interventions in low and middle income countries. And we also have seen that reviews have shown that transported and homegrown programs can be equally effective, as long as they're based in both core principles and practices that are common to many evidence-based programs. And I'll talk a little bit about those in a moment. We've also seen reviews by Professor Francis Gardner, who I work with at the University of Oxford, and other colleagues, that poor families, single mother families, migrant families, and ethnic minority families are likely to benefit as much as other average families in parenting programs. And what's very encouraging is that parenting programs are also equally effective for young and old children across the age spectrum of ages 2 to 10 years old, which means that, you know, it's never really too late to intervene on and provide parenting support to improve relationships and behaviors. So some of the positive impacts of parenting interventions on the lives of children and families that we have found through systematic reviews and meta-analyses include reduced harsh parenting and child maltreatment, improved parent-child interaction, and improved home caregiving environments on the parent level. On the child level, we've also found evidence for improved child development and health, prevention of child behavior difficulties, and reduced child mental health problems, as well as societal outcomes where the parenting interventions have shown to prevent later problems in life and also save money on health and use of health and social services. So what is a parenting program? So most parenting programs that are based in evidence have very similar components, and they focus on helping parents learn skills that are both useful to them and that are in their own cultural language and context. And it's really important that even when you're delivering a program for groups of parents or in different countries or contexts, that the relationship between a parent and a child is different, even actually within a family, that every relationship can be different. And it's also very important that parenting interventions focus not only on changing knowledge and attitudes, but also focusing on changing behavior by providing skills and different ways of strategies to interact with children. Of course, if you've ever done something that has been around behavior change, you know it's very hard to set that as a habit. Sometimes I've gone to a workshop and thought that it would change my life, and then a week or two later, I find myself back into my normal daily lives. So we know that it really takes a lot of active learning, discussions, coaching, modeling lectures, and practicing and maintenance of skills. Some of these similar evidence-based content and principles that parenting interventions that have shown evidence of effectiveness include focusing on child development and health, focusing on nurturing relationships, especially in the early childhood, positive parenting skills, including play, effective communication, positive reinforcement through praise and education and support. Also helping parents learn child behavior management skills, and being able to manage tantrums and rule breaking and non-compliance, as well as other non-violent discipline strategies that can replace violent approaches such as yelling and hitting, and also very importantly, reducing parenting stress and depression. And how are these programs delivered? Well, there's a variety of different modalities that parenting programs can be delivered, including group-based programs, home visitation programs. There can be mixed delivery where there's a combination of both group and home and individual. There are even programs that have been an emerging body of research that looks at the impact of parenting interventions that are delivered online or through mobile applications. There can be flexible settings such as schools, child care centers, health clinics, community centers, religious sites and centers, workplace. And through looking at component reviews, we found that the range of sessions for programs usually are around 8 to 12 sessions and 2 hours per session. And it's important that the programs are delivered to smaller groups of parents so that there is an ability for some collaborative learning. And the range would be around 8 to 15 parents per group. So Parenting for Lifelong Health, which is the initiative that I am a part of, was developed about 10 to 12 years ago as a response to the lack of evidence-based parenting interventions in low and middle income countries that were also freely available. And so myself and other colleagues from the University of Oxford, University of Cape Town, Bangor University, University of Stellenbosch, and other institutions, along with the World Health Organization and UNICEF, started to develop and test a suite of parenting programs that could be across the developmental spectrum that would demonstrate both rigorous evidence of effectiveness in reducing the risk of child maltreatment and improving child well-being, and making sure that the programs were both affordable and scalable for low resource contexts, including making sure that program materials were open source and freely available. And they are available on the World Health Organization's website to be downloaded. It's important to note that the materials are available for free, but the training and delivery has human resource costs. So how does one of the Parenting for Lifelong Health programs work? So here's a theory of change model that you can see where you have core components called, such as behavior management, cognitive stimulation, relationship building, and stress reduction that lead to proximal outcomes such as reduced harsh parenting, improved cognitive development, increased parental involvement, reduced reactivity and stress, and that these would then lead to reduced behavior problems and maltreatment, as well as improved child development and child well-being. But it's not enough to think about a parenting intervention just by what's in it. We also have to think about how the program is delivered. And so here we can think about things like communication boosters to increase engagement, participation boosters that might increase the participation and completion in a program. And those could be things like simple things like raffles or helping out with overcoming barriers to participation, like providing transport vouchers or providing food at a session. And also the training and support that is needed to assure that the programs are delivered with high quality and fidelity. But also we have to think about the sustainment of programs. And here we can think about booster sessions as a way to make sure that there is a maintenance of effects on a longer term basis. So the initial development and testing of Parenting for Lifelong Health started in South Africa, which is the country where I was born. And we started doing research both in the Western and Eastern Cape of South Africa. And then since the randomized control trials in South Africa and beyond, we've now been able to see Parenting for Lifelong Health being taken up in for 25 countries for over 400,000 families, mostly in sub-Saharan Africa, but also in South and Southeast Asia, Eastern Europe, and a little bit in the Caribbean and Latin America. So what is the evidence of effectiveness of Parenting for Lifelong Health? Well, we've done 9 randomized controlled trials of the programs across the different development spectrums, including 6 trials in South Africa, 1 in the Philippines, 1 in El Salvador, 1 in Lesotho, and actually it should be 10 because we just completed a trial also in Thailand. And the effects that we've found have been quite promising and encouraging, including for babies and toddlers, improved maternal sensitivity and responsivity, and attachment, cognitive and socio-emotional development, and HIV testing of children. For the cohort of children ages 2 to 9 years old, results have included improved positive parenting and efficacy, reduced maltreatment even a year after the intervention, reduced dysfunctional parenting, child behavior problems, and reduced intimate partner violence at immediate post-test in one of our trials in the Philippines. We've also found for the adolescent program, improved positive involvement, improved family budgeting, reduced maltreatment, reduced parental stress and depression, and adult and teen substance use, and a cost effectiveness analysis of the program found that there were savings of £6, or I guess $8 for every $1.50 that was spent on the program. So now I'm going to turn to the current situation with the COVID-19 and the impact of COVID-19 on families, and particularly children. So we've seen that there are over 180 countrywide school closures, with an estimated of 1.5 billion children out of school at the moment. And this really means that parents and caregivers, some of you maybe those who are listening right now who have children in the background, are providing between 24/7 care, have to provide 24/7 care to their children. There's no longer the ability to take children to child care centers or to share caregiving responsibilities with other family members through because of social isolation, as well as the role of schools that provide a lot of resources, not only care and education, but also food to children. We've also seen that low-income families across the world are affected the most by these, by both school closures and work stoppages. And we know from previous research that there are escalations of child abuse during health emergencies. And one such case example is the recent Ebola crisis, where there were increased risks of child maltreatment. Unfortunately, everything that I was talking about for the first half of my presentation is not possible. So we can no longer do group-based programs because of the social isolation and social distancing or physical distancing policies that are needed to be in place to be able to prevent or flatten the curve for COVID-19. So we have to come up with a different response. And why? Because there are these increased risks of violence against children due to COVID-19. There's reduced social support of parents and caregivers due to isolation. There's increased risks of alcohol and substance abuse. There's increased stress, depression, and anxiety, somewhat connected to reduced social support. There's increased intimate partner violence that we've seen reports from across the world, including here in the UK, where over 20% increase in reports of intimate partner violence. There's also the impact of living and being stuck in crowded and cramped living conditions, as well as increased financial and food insecurity. And then there's also, because of increased use of online or applications and gadgets for online, there's increased risks of child safety. So together, as I said at the beginning, Parenting for Lifelong Health and UNICEF, the World Health Organization, the Global Partnership to End Violence Against Children, the Internet of Good Things, and USAID and CDC got together to develop a suite of parenting resources that were derived from evidence-based program content from Parenting for Lifelong Health and other programs that had shown effectiveness in low and middle income countries. And they were adapted to fit the context of COVID-19. And these were developed with and reviewed by these partners. So it went through in a very rapid, which is quite unusual for these large institutions, but in a very rapid way, seeing the urgency, we went through a rigorous peer review by different organizations. And we developed 6 original topics that kind of follow the core components of Parenting for Lifelong Health programs. and then also 6 additional topics based on requests and needs from different countries and organizations. And then these were really simplified to be transportable across languages to ease for translation, but also for adaptability across different contexts as well. And it's important also to note that these resources aren't just for COVID-19, but they would be potentially relevant for other contexts as well. So the first one of resources that we developed was called One-on-One Time. And this is really about the importance of establishing and maintaining positive relationships with your child. We know from research that if you can have a very positive relationship with your child, it will reduce the likelihood of you needing to discipline your child and it will also increase the level of compliance and listening to instructions that a child will do, but it also creates a nurturing and loving relationship between parents and children. And so we're recommending that parents try and find 20 minutes a day, that they go down to their child's level, that they allow their child to choose the activity through child-led play, making sure that it's something that is appropriate and safe, and also that they make this really undivided and focused attention. And when we say one-on-one time, we really meaning one parent or two parents with their children. So it's kind of a euphemism for special time or quality time with children. And some of the things on the right are some suggestions that are in the tip sheets that are helping parents think of things that they could do with their children that might be fun for younger children, but also for elders, like dancing to music or cooking and cleaning together. The second tip sheet that we created was on positive reinforcement, and this is around both praise, so using words to support positive behavior so that it would happen more often, but also giving positive instructions to children. Saying the behavior that you want to see is kind of like the euphemism of that. And so, for example, a lot of times when we see a whole big mess in the room, we would say, don't make a mess. Or if a child is running around, say, stop making such a noise, or stop running. But we know from research that children are much more likely, or even adults, more likely to do things if you tell them what you want them to do. So please put away your toys, or please walk in the house, or remember inside voices. And it's also much more effective if instructions are given with calm voices and making sure that children can actually do what we are asking them to do. And also noticing when children are behaving well and praising them to make them feel good. And even for adolescents, we found that they might, in the group-based programs, they might feel uncomfortable with it, but they actually report back that they felt really good when their parents noticed that they were doing something well or helping out. The next one is around making routines or structure in the day. And we know that COVID-19 has really made everybody's schedule really hectic, and it's hard to keep things organized when you are stuck at home the whole day and you don't have the normal structures of getting up, getting ready for school, getting ready for work, going to work, coming home, making dinner, and the things that make up our normal day. So this is really to help parents come up with creative ways to create schedules within their day that includes their children in that making of the schedules. And this can include also, things like structured and free time, making sure that there's an opportunity for exercise even in crowded spaces. We've also got some specific tips around hygiene and physical distancing, including like the 20-second song for hand washing. But also we want to really help parents to know that part of their routine can also be something that a routine of reflection in the day, which is kind of like taking a moment to tell your children or share one positive thing that each of you did, and also give parents, their own kind of self-praise and recognition that things are difficult, but people are coping and doing the best that they can. So we also have a tip sheet that's focused on difficult behavior, that's really looking at redirecting negative behavior to positive behavior before it starts. An example of this might be that your child is starting to tease the other child, and so you redirect your children to a more positive or a different kind of engagement, maybe coming over to help you with something, maybe helping you with cooking or something like that. And also something to help parents with their own stress with what we call taking a pause, which has been derived from mindfulness-based stress reduction, that helps parents just recenter themselves and become more responsive to their children instead of reactive. and then also help introducing parents to the idea of using appropriate consequences that allow them to respond in an effective way that is less detrimental than shouting and hitting and more effective. The fifth tip sheet is around specifically around taking care of themselves and managing stress. And this is really important because it is a very stressful time for a lot of families, especially around financial insecurity and also concerns about health. And so we're trying to give parents some tools along with taking a pause that they can recognize that they're not alone, that it's important to reach out to people. It's important to try and avoid being addicted or being consumed by social media and news reports about COVID-19 and other things, but really also to find some time for themselves and to really take care of themselves as models of their children's behavior. If the parents can find ways to manage their stress, it will also help be beneficial to their children. And so here is the taking a pause that is the one that is derived from mindfulness-based stress reduction. And the last tip sheet that we created in the first set was about how to talk about COVID-19 with your child. And here we're really encouraging parents to be open and listen to the children, to be truthful. It's okay that if they don't know an answer, they can use that even as an opportunity to find out together with their child. And also pointing parents to the trustworthy sources on the World Health Organization and UNICEF's website. And also really making sure that, you know, the parents, that children know that the parents are there for them. The caregivers and parents are there for them, and to really kind of help the child know that it's okay to be concerned and it's okay to have questions, and then to redirect to something that is fun together, but to instead of avoiding talking about COVID-19, to make this an opportunity also to deepen and create positive relationships. So those were the 6 original parenting resources, and then based on feedback from different people, we've also developed and will be releasing soon an additional 6 resources focused on online child protection, intimate partner relationships in the context of parenting. So it's focusing on family harmony as a hope to kind of reduce the likelihood of violence against intimate partner violence and its impact on children. We have a tip sheet that's looking at family budgeting and managing financial stress. Also, we're aware that a lot of families are living in very crowded households and very crowded communities, including refugee camps. So we have developed a tip sheet for that, and also one on anger management. And lastly, for helping parents, some ideas on learning through play. And we would welcome other suggestions from people in the most of our capacity of being able to develop these resources. And so far, we've had a really encouraging reach and response from the COVID-19 parenting responses. They're up on the World Health Organization, UNICEF and Global Partnership websites. They've been disseminated through social media. We have an estimated 4.5 million children that have received the content through different modalities. We've had an amazing group of volunteers, a lot from the World Without Orphans organization that have helped us translate the languages into, now actually it's 59 languages. The resources have been adopted and disseminated by multiple governments, including governments from all over, from high and low income countries. And we've even had mentions in the media. Angelina Jolie wrote a piece and mentioned that the resources were available. And at the same time, we have had some challenges when it comes to reaching more vulnerable children and families, those who don't have access to social media or even smartphones. And so this is something that we are trying to now address in the next phase of the COVID-19 parenting response. And so this slide kind of shows where we are working at now, where we're trying to make sure that there's access to people who have low internet access and low phone access and other online access to higher internet access. And so some of these strategies include making the resources in print distribution. And so we know that in Kyrgyzstan, for instance, the government has put them in food shop checkout counters. There's an idea from the Philippines Department of Social Welfare and Development to include the tip sheets in food parcels for over 10 million families. We'd like to get them out into health centers where people might be going. Also to put them in radio and other media outlets through public service announcements, radio scripts, maybe a parenting hotline that could be on the radio. So helping with scripts to help people do that in their own countries and contexts. There's an idea of having a global hit song or a competition to create songs around relationships and positive parenting during COVID-19. We are also working on creating a text messaging system that could have structured parent support. So these tip sheets are quite large, and they're on A4, 8.5 by 11 sheets of paper, but these would kind of put them in more digestible messages. And we could do some adaptive testing to look at the reach and delivery and adaptation of those sheets, and looking at their impact over a course of 2 months. And then for high internet access families, we're looking at the internet distribution through websites, through teachers, schools, other different resources and links, and through social media messages. And then a very important aspect was to target very high-risk families, including creating a guidance for caseworkers, contacting families by phone so that they can go through a flow chart or a flow and have scripts to work with on that, as well as increasing access for people with disabilities, including making audio recordings of the resources and short videos, and in sign language as well. So just think in conclusion, we know that this is a really difficult time for parents and caregivers, and they're really having the brunt of the responsibility for well-being of children. And it's not easy, and it's also important to accept that sometimes you're not going to always succeed, but you have to practice a little bit of self-compassion to realize that you're not alone, and that there are others that are struggling, and then just to try and do their best to provide for their children in this difficult time. And these are the many different resources and different donors who've supported the initiative and Parenting for Lifelong Health in general. And thank you very much.
Thank you so much, Jamie, for sharing this information with us today. Great information. A reminder to everyone that the slides and a recording of this webinar will be available afterward on the ISPCAN website at ispan.org. We do have several questions from the audience that I'd like to ask now. A few attendees were asking about the applicability or adaptability of these resources for children with various disabilities. Could you address that?
Sure, I'd be happy to. That's a really important aspect. So the tip sheets are focused on parents, and we tried to keep them general as possible. But we noticed that in our first run of the, to be honest, in our first development of the first 6 tip sheets, we did not specifically address the issue of children with disabilities and the increased risks that they have. And so we're trying to do that in our second round of the resources to be more inclusive, and to think about especially children who might be not getting the care that they need from other services, and now have to rely on just their parents for that.
Okay, great. Thank you. We also have a few questions about people modifying these for their own contexts. Is it okay for countries to adapt these tip sheets into their local dialects, for example?
Yeah, that's something that's been happening a lot, actually. So we're trying to keep the content, the actual evidence-based content the content's been derived from evidence-based interventions consistent. So there is a need for cohesion and consistency of the messaging, which has been also reviewed by WHO and UNICEF. But at the same time, we want to be able to be contextually flexible. And so in some places, there has been some redesign of the tip sheets to be a little bit more within like an organization or a government ministry's formatting of how they disseminate information. And also, like, for instance, we've had the tip sheets translated into Filipino for the Philippines, but also a volunteer got them translated into Hiligaynon, which is not one of the more widely spoken languages, but that makes it more accessible to those families. So we welcome people to get in touch via the www.covid19parenting.com so that they could, if they have ideas of or wanting to translate the tip sheets into their languages or other languages.
Okay, great. And you may have mentioned this, but someone is asking about also the adaptability for different age groups. If you could review what age groups um, these sheets were targeting.
We had this is a very good question. We had a long discussion when we started initially 3 weeks ago developing these resources. We thought maybe we'd create 3 different streams. So a stream for early childhood and for infants and babies, and then toddlers, and then one for ages 2 to 9, and one for 10 to 17, 18 years old, like the Parenting for Lifelong Health programs are designed. But then we realized that that would create a lot of issues when it came to its global dissemination and translation and adaptability. So we tried then to make them relevant for ages 0 to 18. Parents and children, we know also that parents and children parents have children sometimes of many different age groups. So we wanted it to be applicable to all of that. At the same time, we do want there to be some specificity, and what we're looking at is potentially developing tip sheets for early childhood and one for adolescents, but within the text messaging system, there could be different streams that parents could engage with if they had a child who was a teenager, if they had if they were just like having a like an infant in their family and they wanted to get specific resources on that, that could have a little bit more targeted specificity.
Okay, great. Thank you. I've got a question here about how, if you have any recommendations about how parents can explain about COVID-19, for example, with very young children. You know, if the
Yes, I think
children
it's
maybe aren't even asking about why they're home, but how much should they know or share with their kids?
It's also a really good question. And the tip sheet that we have that focuses uh, on talking about COVID-19 with your child gives some background, but I think that what's important is if you look at if they would to go and download the tip sheets from different websites or sources, they also provide extra links to helping parents with more information if they want. But I think what's important when you're trying to talk about COVID-19 with very young children is to recognize their developmental stage and how much they can understand. And sometimes it's more important to be a reassuring presence for children, and to be reassuring and to be there, to be supportive for children, to realize that children may be scared and confused, give them a chance to share how they're feeling, and then tell them in a way that might be understandable to them about the risks and the importance of practicing physical distance and hygiene, and how they can take action in their own behaviors of the way that they interact with people in a to protect themselves and to protect others.
Okay, great. Here's a question about whether you think these resources are applicable maybe in institutional settings or with, foster caregivers or other types of situations like that.
I think some of them might be. There might be also some things that might not be that applicable. If somebody's taking care of many children, then you might need some specific help and support. And I think there are different resources out there. Change the Way We Care is a great organization that's been putting out some resources around support for children in institutional care. For foster care, I think that the relationship it's also an opportunity to develop a positive relationship between you and the children that you're taking care of, whether they're not your biological children or not. And when we say parents, we really are referring to any adult who is taking care of a child between the ages of 0 to 18. We know that in many contexts, this might not be the biological parent, it might be another relative, or there may be situations where children are being taken care of by neighbors or by other people as well. So I think a lot of these tip sheets are relevant for all kinds of relationships and human behaviors, but there may be some need for more specific support for those who are dealing with maybe issues around recent fostering or very difficult relationships.
Okay, thank you. Do you have any recommendations for getting this information out in communities to like illiterate or low literacy parents or households?
Yeah, this is something that we've been also talking about. So one of them was to be able to have these tip sheets be transformed into video and audio messages. So that would be helpful if you had like bandwidth and airtime to be able to access those videos on your phone or other kind of gadget. But we also so that could be very good for people who have difficulty reading or learning disabilities, intellectual disabilities. But we also realize that, you know, a lot of families don't have even access to phones in very poor, low resource settings. And so one of the things we're working with USAID and their PEPFAR beneficiaries in sub-Saharan Africa, as well as with UNICEF in the Philippines, is to develop these public service announcements that can be either read on the radio, but like for instance in the Philippines, they have quite robust warning system for typhoons, and that with loudspeakers in communities that can be then used now for disseminating important information. And so we're trying to we're in the process of writing these scripts that could be read by a community leader, or they could be read on the radio, so that we can help other, you know, these are all the kind of challenges of, you know, overcoming some of these barriers to access that we are now looking at in this second phase of disseminating resources.
Great. We've had a couple questions about using these tips for specifically for parents who are also working from home. I don't know if
Mm.
you've addressed that in any way or have any suggestions.
I think the tip sheet around scheduling or routines might be helpful. I know this is really challenging because you have your children to take care of and you have your work to take care of. And some of this is also we've tried to address in our upcoming tip sheet around family harmony, about discussing, having adults discuss together how they can share caregiving responsibilities. And this might be relevant for families where you have multiple adults taking care of children. I know that some people like to have, you know, one person is in the morning childcare and homeschooling and the other person's in the afternoon. And that's possible, but in some contexts you also have it where you're a single parent and you're having to take care of children and do your work at the same time. And that can be really challenging, and it requires some patience and hopefully some understanding from employers about the challenges that people have, but also maybe the possibility of you know, scheduling the day so that there's quiet time where children are engaged in activities, and so you can do some of the work that you want to do or need to do. But I recognize that sometimes this isn't going to work, and so sometimes it's going to be days where you feel like you are under a lot of stress or unable to get the work done. And it's really, that's where some of the strategies that can be helpful around mental well-being are important as well.
Great. Several of our attendees are concerned about contexts where corporal punishment is the norm.
Mm.
I don't know if you just want to speak to maybe, you know, approaches in those situations, or how this advice can be maybe adapted for those situations.
So you might, it's also a really important question. So a couple of things. First, these are resources that are being delivered through, you know, internet and through print media and other forms, but they're not going to replace the impact or the potential impact of group-based parenting interventions. So the Parenting for Lifelong Health parenting programs, as well as other parenting programs that have been rigorously tested, you know, have shown effectiveness at reducing violence against children in contexts where 70 to 80% of the families are using corporal punishment and other harsh means of punishment or discipline with their children. And, you know, this is really light touch. So this will maybe, have a much smaller impact on reducing violence against children. But on the other hand, a group-based parenting program might not reach millions of families, whereas these will. So there may be some small, maybe the effect might be smaller, but it might have a potential to affect more families. And if it's combined with other communication strategies, there may be some shift in norms, although it's very difficult to evaluate that in this time. So it's more like in a humanitarian emergency, we're trying to just do the most we can with the limitations and constraints that we have. Just another point is that when you look at the tip sheets, we never say to, or never have any place in these, and it's also the same in the Parenting for Lifelong Health programs, never say don't hit your child, or violence against children is bad. We know that because these programs are being delivered in places where there's high acceptability of corporal punishment and high rates of violence against children, that telling a parent what to do or what not to do is probably not the best way to get them to change their behavior. So what we try, and the programs are really focused on, you're having difficulty. I know parenting is very stressful. Taking care of children is very stressful. You might have a child with very difficult behavior, or an adolescent who's pushing boundaries and questioning authorities. And so, this program might be something that might help you manage your child or improve your relationship with your adolescent, with your teen. And this is kind of been tried to model that into these COVID-19 parenting resources, where we're really trying to get to parents at places where, recognizing that things are difficult, providing them with some suggestions, but it's not going to replace the effectiveness of working with parents with coaching and modeling and giving them opportunities to practice and giving them reinforcements that a real parenting program or a face-to-face, group-based, in-person parenting program will do. But this is kind of like the realities that we're looking at. We are in the process of developing an entire app for Parenting for Lifelong Health for adolescents, but that's going to be only ready in about a year from now. So for testing in about a year, because that's quite a lengthy process. We're hoping that the interactive text messaging can help parents a little bit and maybe give them some more support on a gradual basis, like modeling on the parenting program, but it's still not going to be a group-based program where parents get support from others as well as a facilitator. So there are limitations.
Okay, that sounds great. That app sounds really interesting. There's a question here about data that wondering if data is being collected on the effectiveness of parenting programs using these tools, and if there are evaluation tools available for countries to use around these resources.
That's also a really great question. Something I'm working at the Department of Social Policy and Intervention at the University of Oxford, and doing evaluations and rigorous testing is really part of the essence of this program, and the Center for, the department and the Center for Evidence-Based Intervention. And so, when we started looking at the second phase, we thought, well, how are we going to evaluate the program, and how these resources, how are we knowing that this isn't just throwing, seeds up against the wind and blowing them back into your face kind of thing. So we're trying to, we're trying to evaluate the initiative, or the COVID-19 parenting global resources in a couple of ways. One is to monitor their reach and their the way that they are being disseminated, and that can be on multiple levels, both within in-person dissemination, but also online, and tracking that through analytics. But we're also working with the Internet of Good Things that has a kind of feedback mechanism. So it's not like a rigorous survey, but it is a way to have parents being able to provide feedback to whether or not they find these resources helpful to them, and suggestions for other content and initiatives. And then within the text messaging system that we're developing with UNICEF, we hope to have embedded in that baseline evaluation, as well as 8 weekly assessments, very short assessments, so that they don't turn people away, but that are parenting behaviors as well as parental mental health, so that we can use latent growth curve modeling to track change over time. And there may be possible ways of doing this in a randomized control trial type design, but we're thinking that because of the emergency situation, it might be sufficient to just track the impact of the program instead of randomly allocating families to not receive the resources.
Okay, great. We have so many great questions coming in. I'll just keep
That's
going here.
wonderful. I mean, it's great to be able to. I was glad that my talk was short enough so that we could have the time to be able to try and have this kind of discussion or engage in questions.
Yeah. There's another question here about parent mental health you were just mentioning. This person is asking about if you have any insight into how situations involving alcohol or substance abuse might affect the implementation of these tools or strategies, or how they could be adapted or expanded for those kinds of situations.
That's also a very good question, and something that is of great concern because of the associations between alcohol and substance use and violence against children and intimate partner violence. I know that in some countries, actually, they put limitations on alcohol, purchase of alcohol. In South Africa, initially they had banned that for a month, and then they made it very limited rationing. I know in other countries they've made it, they've also banned it, like I think it's in Thailand also, they've limited the use of, or the ability to purchase alcohol to reduce this risk. We did talk about whether to explicitly mention drugs and alcohol, and we thought that we would instead kind of bring the attention to other kinds of activities. But in the anger management one, where there is a bit on, trying to reduce the risk by, like if there are things that you think that are not going to make you be able to care for your child in the best way, maybe you'd want to avoid those for this time or try and reduce them. But in contexts where families have one member that has substance use disorder or both, it can be extra difficult for the children. And I mean, to be frank, I don't think that these sheets are going to, that needs a greater intervention. And in some cases, as indicated in my presentation, the World Health Organization says that it is acceptable for there to be removal from care in situations where there is ongoing physical abuse or high risks of violence. So that's still a possibility, maybe in some contexts where children are at high risk.
Okay, great. Thank you so much. We've had a couple questions about implementing these strategies in high-income countries. The focus is low and middle income, but are there any adjustments that you would make in such a situation, or anything you can say there?
Well, I think that there are low-income people in high-income countries. So in some ways that they're very, they're applicable to, but they're not just applicable to low-income families or low-income contexts. They're these are universal child behavior management and relationship building, social learning theories that are going to be applicable for high and low income families and contexts. Interestingly enough, if you look at the metrics for the COVID-19parenting.com website, the most downloads and visits are from Italy, and then UK, then USA, and then Jamaica. So, I mean, that's just from, it's not the only place where the resources are being disseminated. And sometimes a government will take it and then put it on their own website, and that's where people interact. But there is it seems to be that people are really engaging in it and finding things useful for all parents from all different backgrounds. But we are particularly concerned about those who are living in very difficult situations with crowded households and with high economic stress, as well as those who don't. Parenting is difficult for all families in all contexts.
Yes. Okay. Thank you. It's very interesting. We've had a couple questions about one of a specific tip, the one-on-one time. People are asking if this means if families have multiple children, if this means parents with each child one-on-one or parents with all their children.
It's a great question. I mean, we get the same question when we're doing the actual group-based interventions as well. So, like, what if possible? One-on-one time would mean one-on-one time. So you and one of your children, and then maybe finding somebody to look after the other children, or finding another activity for the other children. But we recognize that this is not going to be always possible in all the contexts. And so one-on-one can be one on many. The more important thing is that you're really giving your children that kind of focused attention, that your phone is away, that you are, coming up with things that you could do. If it's more than one child, then something that can be done in a collaborative way where each child gets a little bit of a chance to take the lead and choose the activity, and then maybe sharing that responsibility. And those things really can be done, adaptable to having a parent with multiple children if necessary, or if there's nobody to take care of your child. Or it can also be that you do maybe less time, so maybe it's too long to really consider, like, your 3-year-old to be able to do something while you're spending one-on-one time with your 11-year-old. So maybe that's like you do like a 5 minutes with the older child, and then involve the younger child as well, if possible, or when the child is sleeping. So there can be ways that I mean, when we think about the benefits of this kind of focused quality time with the child, but really it's giving the child developing a secure relationship. It's developing a positive nurturing relationship between the parents and caregivers and their children. But it's also helping the children. When you allow the child to take the lead, it's helping the child learn leadership and responsibility, and it shows that the child is important. And you, as a parent, are modeling how to follow the lead when you're doing this, so that when you are the leader in other activities outside of this kind of one-on-one time, you've shown the child how the child can follow you. So there are multi-directional benefits.
Great, thank you. And we're getting close to time, but one more topic to address that a few people have asked about. We want to be hopeful about the situation, but people are wondering about short-term versus long-term. If this situation lasts into the summer or longer, do you feel like there would be a need for a differentiated approach or intervention, thinking about the psychosocial effects of quarantine living? um,
Hmm.
what have you been thinking about that long term?
Yeah, I think that this is something that is a real concern, and even when physical distancing restrictions are gradually lifted, they're not going. We're not going to be going back to being maybe able to have a group-based parenting program with 20 families in it, like they have been doing in within like the Dreams PEPFAR interventions in Tanzania for HIV affected families. And so there may be some need to adapt to smaller group-based work at first. But then thinking about this question around the long-term psychosocial impact of both physical distancing, but also the financial and economic impact, which might be even more acute. I think that there will be some need to think about how we can support families and equip them with the wherewithal to be able to provide the best for their children in that time. And maybe there needs to be, by then, some more adaptive ways of intervention, so that we're never going to replace direct intervention in person, but maybe there are other ways to create support groups that we'll explore. We're learning a lot very quickly, and trying to do the best we can in a very short amount of time.
Yes, thank you. Well, that's a hopeful note to finish on. Um, Thank you so much, Jamie, and thank you to the audience for all of your great questions. We could not answer everyone's questions today, but please know that you are free to contact us at ISPCAN or Jamie directly if you have specific questions, and we will make sure to to get those to him as we can. And we just wanted to point your attention to our COVID-19 resources page at the ISPAN website. We have a variety of resources for different disciplines as well as for parents and children. At the bottom of this page, you will also find a forum where you can post comments and questions or discuss cases or opportunities to collaborate. And you can also sign up here for alerts when others post. And Jamie, if you wouldn't mind just telling the audience again the best place to go to access the resources.
Well, the best place to go for accessing the resources in over 55 languages would be www.covid19parenting.com. But you can also find them on the World Health Organization website and UNICEF website. If you search for COVID-19 parenting UNICEF, there's that and more resources, like both are promoting the Heroes book and other things. So I encourage people to look for the specific resources on covid19parenting.com, but also go to the WHO and UNICEF's websites for other resources on parenting and child safety and well-being.
Great, thank you. And a reminder that a recording of this webinar and a PDF version of the slides will be available on our website at ispan.org. If you have we also encourage you to become a member of ISPAN if you're not already, so that we can continue having webinars like these in the future. If you're interested in presenting or have ideas for a topic, please feel free to contact us at resources@ispan.org. Thank you again, everyone, for joining us today during this very challenging time. And thank you again to Jamie for giving us your time today and giving us all these great insights into positive parenting. We hope that you all have a good day or night, depending on where you are. Thank you, everyone.
Thank you very much, Heather.
You too. Bye-bye.